Welcome to InFocus, a closer look at human relations presented by the Cincinnati Human Relations Commission. I'm your host, Chris Stiles, and in honor of Minority Health Month, we are taking a look at health disparities in our community that continue to affect us and that we need to find a prevention. So today's guests are the Executive Director of Closing the Health Gap for Greater Cincinnati, Ms. Renee Mahaffey-Harris, and City Council Member Charlie Winburn. Welcome to InFocus.
Thank you.
Thank you so much for being here. Closing the health gap. That's like super important. Just saying that alone makes people stand up and listen. So how long have we had Closing the Health Gap?
10 years. This is our 10th year. Dwight Tillery, former mayor of our city, founded this organization in 2004. He founded it because he started looking into the issue of health disparities and then started looking at the data in the city and realized that where you live and who you are from a racial and ethnic perspective affects your health and how long you live. And said, you know, we got to do something about this. And so he brought together stakeholders across the community, about 40 individuals who really looked at best practices across the country and said, you know what we need to create? We need to create an organization. And this organization was created, the Center for Closing the Health Gap. Our focus is on the African American community, as well as the Hispanic Latino community and white Appalachian populations of our greater Cincinnati area.
So it stands true that minorities, us, myself included, we are not that into our health. We don't take it as seriously as we should. And you also mentioned something about where you live determines your lifespan, so to speak. That's pretty serious.
It's very serious, and you know, the first 5 years of our organization really focused a great deal of just making people aware of the fact that we have health disparities, and that health disparities affect about 10 disease areas, but we as an organization decided to focus on obesity because of the fact that obesity is a predeterminant for so many other diseases such as heart disease, stroke, some forms of cancer. But the issue is meeting people where they are, helping them understand what they can do. Because if you really look at health just from a chronic disease perspective, it can be overwhelming. But if you can begin to see the baby steps you can take, the little things that you could do differently, once you start learning how to read a food label, once you start learning how to do 10 minutes of exercise, and I know Councilmember Winburn can speak a great deal to that, and we are very, very grateful of the support from the City of Cincinnati and all members of council and the mayor in supporting our mission and being a partner in addressing the condition of our city specifically, and really giving people the tools and equipping them with the power and empowering them to be able to be a part of their own health solution, because that's what we're about.
Okay, and when we talk about health, Councilman, it's not just food, it's not just what we eat. I mean, health is a broad spectrum. I mean, it's everything involving our lives. Do you want to touch on that?
Yes, well, first of all, let me just thank you as a great host and this wonderful executive director. And I want to thank Mr. Dwight Tillery, the founder of this really dynamic organization over 10 years. I think it started in 2004. And I believe when Mr. Tillery put this together as founder, that he was looking at health from a holistic standpoint. And health is holistic. It's actually on 5 levels. Okay. First of all, our spiritual health is very important, where you at spiritually through your spiritual awareness. And then number 2, your health life. And then number 3, that even if you get your health life together, there's another component called your mental life. You got to have really mental soundness and mental stability, but your physical health undergirds all of these. Your next one is your financial health. And you got to have that together. And then there's one more, your relationship health. So, but health, physical health, really is key to it all. Because if you're not feeling good, you're not going to feel good spiritually. You're not going to feel good financially or in your relationships, or feel good mentally. So I see it from a holistic standpoint. So health involves all of it. By the way, I do about 2,500 miles a year of exercise. I know I look pretty good, you know.
2,500 miles a year.
Yeah,
wow, that's a big
right.
number.
And I'm 63, and I just got all my lab work the other day.
Good.
Oh, thank you. What I need to
follow your regimen.
That's good. That's right.
know,
Yes,
right?
but it's exercise every day, eating healthy. All of my blood work is great, you know. And we just was looking at certain areas that men have to look at in the blood area. So you have to work at it. You got to be diligent with the process.
Now, Councilman, I have to be honest. I mean, I have to admit, when you have those 5 things, your mental, your spiritual,
Yes.
you know, your physical, and are we as a people, minorities, are we really going to take the time to actually focus on all those things to make sure that we are healthy so that we can close the health gap and we can live longer? That just seems like a challenge to have to focus and fix all that stuff.
Well, we're not here to talk about my class. I have a 68-second super course that actually teaches you how on April the 1st. I'm not going to throw that in because this is about closing the health gap.
Right.
But basically, I actually teach people. I'm a facilitator. I train people. I'm a life coach. I train you how to focus on those 5 areas: your spiritual awareness, wherever that is, then your health life, and then put together a plan for your relationship life, your money life, and all that. So it's holistic. But the health, your physical health, if you're not feeling good, it really undermines everything.
Well, let me elaborate on that. Social determinants of health are really all of the factors that affect our overall health. And I know when we talk about health, we will often talk about health care, medical coverage, but in the scheme of 100%, 20% is health care and medical treatment. The other 80% has to do with where you live, whether or not you have a job, whether or not you have good housing, and as you said, the mental and spiritual place for yourself. So what we are doing at the Health Gap is really meeting people where they are, teaching them and engaging them in how to advocate around their health. That means knowing the questions to ask when you're at the doctor's office, knowing how to identify a primary care physician or a specialist that you may need, and really how to advocate on your health needs and advocate on what you need to feel better. Because it really is, when we talk about it, I don't know that we necessarily talk about it in terms of health, but we say, what's going to make you feel whole, feel better, and ready to go out there and tackle the world and deal with life. We want to deal with the person at that holistic perspective, and then how to empower you. And we have lots of evidence from the work that we're doing in our Do Right campaign, which is a family obesity campaign really focused on simply teaching people how to eat, live, and move right. And it had the simpler, the better. When we go in with simple steps and someone sees, wow, I just stopped drinking 2 liters, maybe a 2-liter pop a week.
Yeah.
And seeing that small incremental change based on that one change says, oh, okay, well, I did that. Now I can now I can put on that pedometer and walk maybe, 5,000 steps. Okay, now I can move it. And it has to be that simple. When you go at it kind of a bigger perspective, okay, we have this obesity rates, and unfortunately, we as African American women represent 77% of obesity rates, not represent, but we have, so we are at the top, followed by Hispanic women. And so that trickles down as, women, mothers, head the household, not head the household, but, are key to the health decisions in the household as far as, purchasing, but we're all accountable, okay? And so we have to teach people where they are, and that doesn't mean saying, okay, we're going to just change your whole diet. And many people think it costs so much more to eat healthy.
They think they have to go organic.
Right.
I mean, when you say eating healthy, you're like, okay, everything has to be organic. It has to be GMO or GFE, whatever, free, something like that. I don't know all of that stuff.
No, it's simply just learning how to read a food label, understanding the impact of the salt intake, the sugar intake, and really understanding those principles. I mean, and again, there are lots of programs that we've done to Masters of Nutrition Train the Trainer, where we've trained 88 people in the community to go out and train other people in the community so that we can learn how to eat healthier, live healthier, and really make it simple, though. Yeah. It has to be simple.
As chairman of the Budget and Finance Committee for the city here, and I want to thank Mayor John Cranley because he's committed to this issue. We've made health #1 priority under our budget. So I've asked, when we reorganized council and the new mayor came in and the new administration, we made health #1. So we're going to be working on initiatives, and I'd like to see more funding for closing the health gap on a more permanent basis. I'm talking about a permanent basis because of your advocacy, your education. You've been diligent. This is a research-based organization. They just don't make up stuff. And really, you've just been great. And you have, the Closing Health Gap has impacted thousands of people. I believe last year at your event, you had what, 6, 7, 8,000 people, 10,000 people. That's a lot of people.
Washington Park.
Yes. So I'm committed as chairman of the Budget and Finance Committee, and I'm going to speak on behalf of our great mayor, Mayor John Cranley. It's a priority, and we plan to work with the Closing the Health Gap and hopefully develop a regional plan where we can really significantly impact it. But we got to give more funding and do our part.
Well, many cities across the country are really, and states are focusing on what's called health in all policy, so that you see health as a component of everything, from how you build your streets, how you build housing, how you build schools. That is the approach of the future, and I'm excited that we have such leadership from Councilmember Winburn and Mayor Cranley and other members of council relative to this issue and the issue of food deserts, which I guess we're going to get. I'm sorry, I'm jumping ahead.
That's right.
And infant mortality rates in our city. So that there are many factors, but we got to equip people who are impacted to be a part of the solution.
Well, and then I wanted to touch on, we mentioned the schools, you know, and the health factor, obesity, and a lot of that is set in a setting the child early,
right.
You know, and I've always wanted to, I was like, okay, I'm gonna invest in my own vending machine, and I'm gonna put healthy stuff and good stuff in there and try to put that in schools and see how that works. You know, but how important is it for us to educate the kids on that? I mean, I wondered, and as far as your 10,000 attendees that you have at the that you've had at the previous Health Gap, the Expo, how many of those were children, and how many children were actually touched, and do we have any evidence of children changing their thought processes into healthy eating and possibly, you know, moving away from obesity?
Well, we do have evidence of how we have impacted children's knowledge and ability to really share that information back to their community through our Do Right Kids intervention, which is an after-school intervention. It's a 13-week program that we have taught in 5 elementary schools in the city of Cincinnati, and look forward to continuing to build that number. But I believe that when we train our kids, our kids can train the parents, and that's the evidence we've seen. We have teach back sessions in our family nights, and the kids are teaching their parents about nutrition and healthy eating and physical activity. And you know, physical activity doesn't have to cost a lot. The family just got up together and danced. And this year's theme of the Health Expo is Happy Health is a State of Mind.
Okay.
And if I could add to this, one of the things, it takes actually about 30 days to change a habit, and especially in the African American community. If we could just get them in a class or get them in some type of one-on-one, work with changing your pattern. And matter of fact, in changing our pattern, you can change anything. And I'm going to be contacting your founder soon, Mr. Tillery, and talk to him about, and maybe what I'd like to do is have a booth set up at the, we're going to talk about that, right? The Expo. But I believe that and I'll say it quickly, there's 5 stages to changing a habit. And you could do it in less than 30 days. And we take people through something called, it's the imagination stage. So you got to imagine yourself losing 30 pounds. And then
visualize that, yeah.
That's right. Then you realize,
right.
That's right. That's right. So it's called
That's right. Speak it into
Think
existence.
It. And then the next one is called the creation stage. So we have you begin to, how would you like to create yourself? How would you like your body to look? So that's called the see it stage. But that's not enough. Then we're going to help you to get a pad and pencil and do what we call the design stage. So you got to design your health. And then the next stage, you got to build your health. You got to feel good about it. And then finally, it's called the execution stage, the do it stage. And if we can just get people for 30 days to change their habits, they can change any aspect of their life. They can change their health.
You know what? I totally agree with everything you're saying. There's so many things that we haven't touched on, but don't worry about it. We'll have an opportunity to do so. You all are watching InFocus, and we are focusing on Minority Health Month. Closing the Health Gap of Greater Cincinnati is here, and we'll be back with the Executive Director, Renee Mahaffey-Harris, and of course, Councilmember Charlie Winburn. Stay with us.
I had diabetes, and I didn't even know it.
America's the land of opportunity, but our urban populations, our most vulnerable neighbors, get sicker and die faster than others. It's preventable and unacceptable. The Health Gap improves the well-being of our entire community. From health screenings to healthy eating programs, we're making a difference.
The Health Gap helped save my life.
Join the campaign to end health inequities. Volunteer, donate, advocate. Help us save a life.
I'm Mayor John Cranley, and I believe that every citizen deserves the best chance to be healthy and live a long life. But in our city, there are vulnerable populations who get sicker and die faster than others. It's preventable and it's unacceptable. The Center for Closing the Health Gap is working hard to improve the well-being of our entire community. From health screenings to healthy eating programs, the Health Gap is making a difference. So join the campaign to end health inequities. Volunteer, donate, advocate. Help us save a life.
All right, we are back with InFocus with our guest executive director of Closing the Health Gap in Greater Cincinnati, Ms. Renee Mahaffey-Harris, and of course, City Council Member Charlie Winburn. And we are talking about minority health. Closing the health gap is what we need to do. Now, we're focusing on minorities, and you had touched earlier on food deserts. And it's just like, huh, what is that? What's a food desert? But it's so important, it's so relevant to our community and to us as a whole, improving our health. What is a food desert?
Well, the fact that you're asking me that question is a part of our work.
Okay.
A food desert is a community that doesn't have access to full-service grocery store.
A full-service grocery store.
It
okay.
also is a community that has a high concentration of fast food restaurants. It's also a community that has a high concentration of small stores that aren't offering healthy food options. So it's about access to healthy foods.
Like those stores that serve the fried chicken and sell the hair weave in the same store. That's,
Yeah.
I mean, fried chicken's not real healthy. It's good, but it's not real
It is
healthy.
good. But the crisis is that in Ohio, and specifically Cincinnati, is 10 stores fewer than the national average of full-service grocery stores being located in communities at 24,000 people per store, right?
Well, we keep building these mega stores, these mega grocery stores and everything, but we're still short.
We're 10 short of
Wow.
the national average.
Okay.
So we joined forces with the Food Trust out of Philadelphia to replicate their successful models of creating a fund to attract grocery stores to the city of Cincinnati, and thank you for that support from City Council, Councilmember Winburn, Councilmember Young, and other members of council, as well as our mayor, who helped seed the creation of this fund that's going to allow us to attract grocery stores to our food desert sites. And that's grocery stores who want to serve and work in smaller subsets of this greater Cincinnati community and employ people in the community and design stores that may have a cooking kitchen in it so that everyone can learn how to prepare healthy food. So one thing to provide access, but the education to that access is critical. So you can build it, that doesn't mean they're going to come. Okay. But what we want to do is help foster that building happening, but also educate and educate by educating each other so that we can teach one another how to be healthier.
You know, when we talk about the grocery stores, something we were speaking about off camera, about how in certain communities, certain stores only carry certain foods. So even though we're near the university, if you go to the Kroger's near the University of Cincinnati, they're not going to carry everything that you can find in the Hyde Park store. And obviously, the Hyde Park store is not in a minority community, meaning a lot of those organic and healthier foods, so to speak, are not even accessible in our community. So that's what part of the Food Desert campaign is.
Well, and it's part of the education. Mm-hmm. So again, earlier I said it's about engaging, advocating, empowering to change. We have to advocate for what we need, but first we have to understand what we need. We need to understand that in order to eat healthier, we need to understand what's coming in our bodies. We need to understand how to read a food label. We need to understand the options, how we can grow our own food, how we can can that food. And those are all kinds of initiatives that we've done at the Health Gap through our faith-based organizations in particular. We have trained over 126 churches in our greater Cincinnati community on how to develop health ministries to focus on the needs of their congregation and the communities that they serve.
That's wonderful. So you do have a lot of churches involved with Closing the Health Gap every year. Who are some of your stakeholders?
Some of our stakeholders overall, our funding partners are City of Cincinnati, Mercy, Tri-Health, Christ Hospital, and UC Health, as well as Interact for Health is one of our newest partners. So all of those organizations serve, the city of course serves the entire city, and each of those hospital systems serve the entire city in the greater Cincinnati region. So it's a partnership. The stakeholders, most importantly, are the very people who are affected by health disparities. And so our job really, and I always say, when people say, well, you know, what do you guys do at the Health Gap? Well, our job is really to be the teacher, and we're equipping individuals with the power to change the choices and decisions that they're making that are affecting their lives, from healthy eating to physical activity to the conditions of their neighborhood, being they have a grocery store, if they have a corner store, making that corner store healthier, partnering with that store owner to help them have healthier food items. So it's really teaching how to advocate for what we need in our communities.
Yeah. What I was going to add, even when we correct and clean up the health deserts, we have to also clean up our minds, because I really believe our diet, our health, is what we're feeding our minds. We hear very little about what we're feeding our minds. You don't become obese unless there's something wrong with your mind. You don't become unhealthy unless there's something going on in the mind. And that's why I'm convinced that the law of attraction says whatever we focus on, give our energy to, or give our attention to, we get more of it. I look here, it's like InFocus, and that's what the law of attraction is all about. So we've got to have a mind transformation also. And that's why I like closing the health gap, because it actually, you look someone in the face and you say, you know what, you need to change in all these areas, in your spiritual life, in your mental life, your financial life, so that you could have a holistic health life.
Well, and I want to add to that, the approach we use, which is where I should have started, is research is a foundation of all that we do, evidence-based practices. However,
Thank you
research is sometimes a term that you think of from an academic perspective, but what we do is utilize an approach called community-based participatory research. And that means exactly what it says, that we are training individuals in the community to be able to research, meaning how to develop a survey, how to disseminate that survey, how to analyze that data, so that together in the community, individuals are going to figure out what kind of strategies or what kind of activities are you going to participate in, meaning not me, but what you're going to do and how you're going to be able to be supported and support the community to continue that work. Because, you know, programming dollars, resources often are very limited, but we got to create sustainable strategies that are going to change the lives of our communities from today to the future.
Well, I have to admit, I do know that there are some service venues and stores, even fast food restaurants, are trying to be more healthy and promote health in the community.
Right.
So even though our minority communities may be a little heavy on the fast food restaurants, they have, you know, a healthy eating menu, and they start putting up the statistics, how many calories and the sodium and things like that. So that's a plus in our community. But again, closing the health gap needs you to focus as an individual on your healthy well-being, correct?
Exactly. It's all about lifestyle. Lifestyle is 50% of the equation, how we live our lives, the choices we make, as you've said, on a daily basis. But the great thing is we have evidence showing that people are getting it. And once they get a little bit of it, a little bit of seeing, hey, I can take this one simple step of changing one piece of my life that's affecting the longevity of my life. Because it is about saving lives of our children, of adults, and of a population that unfortunately is dying faster than any other population in this country.
That's a great segue into my next comment. You mentioned a success story. Closing the health gap has been something, it's been an expo that we're drawn to. One, because I love free stuff. So when you go down there, you get
free health information, that's right.
You know, a lot of information and hands-on, and you get tested for a lot of things that you don't normally ask your physician about if you even go to the doctor. Because if you don't have health insurance, which fortunately over 4 million of us do now because of the new CARE Act put in place by the president. So thank you. But you have success stories. You were telling me about a young woman who came in and was tested, and now she's doing better. Tell us about that.
Okay, well, first of all, I'm going to tell you about the Expo. This year's Expo is Saturday, April 26th at Washington Park from 10 to 5 p.m.
Oh, it's outside.
And it's outside. This is our second year being outside at Washington Park. And over the years, we have reached over 51,000 people. We have conducted over 18,000 free health screenings, and that is all made possible by our health partners, which include the local hospitals of TriHealth, Mercy, Christ Hospital, and UC Health, City of Cincinnati, and Interact for Health. So those partners, those stakeholders make it possible, along with many community college students that come out and are part of help delivering those screenings, the Cincinnati Medical Association, physicians that come out and do Ask the Doctor. So once you've gotten screened, then you can ask a doctor a little bit more about what that screening told you. And then this year we're adding another component in that we're going to have a resource guide of primary care practice physicians' practices that are accepting new patients. As you mentioned, that 4 million people that are now eligible for health care, we want to make sure that you not just get access to insurance, but then you take the next step and get connected to a primary care physician so we can begin to do those preventative things to improve our health and reduce us being the top of the list on so many of these chronic diseases that we lead the way on. But we can change that. but prevention is the way to change it. This year's Expo also will have a children's pavilion, move-in and groove-in stage, and we have many sponsors and partners that make that all possible.
You guys did salsa dancing and stuff too.
That's right. And our moving and grooving stage in the gazebo, we have fitness demonstrations from 10 o'clock till the close. This year, come out and join in hearing entertainment from Confunction at the close, and also come out and help us make the Guinness World Record of the largest wobble line. So we invite everybody out to be a part of the wobble line and help us make a Guinness World Record. And you know, again, our theme that our CEO, former Mayor Dwight Tillery, this theme is called the song Happy. And it's about health as a state of mind. So it's back to what you said. It's like, you know, what you feel, you believe you can be.
How do we get a booth? Because I'm looking to have my 68-second technique.
We can talk about that after.
Is this open to the public?
Yes, it is open to the public.
People
Exhibitors
can purchase. They can do that? Okay.
The event is free. If you want to be an exhibitor, you can contact our office at 585-9878, or visit our website to learn how you can be an exhibitor this year at the Expo. And we are accepting. We need volunteers. Over 600 volunteers make this event possible with health screenings. And I also want to add that this year, the testimony you were referring to, we have a health inequities campaign that we've launched recently. And one of those commercials is our mayor talking about this issue of health disparities in our country, which is costing us $82 billion annually. And if by 2050, where minorities will make up the majority, we don't begin to address these factors, it'll be $360 billion impact to our government, to our country, and health disparities.
So having all that said, you all have been around for 10 years. What is on the horizon for closing the health gap?
The Health Gap campaign, I invite you to visit inowknow.org.
I Now Know.
And hopefully you've seen commercials on TV and heard it on the radio and seen the billboards, where we focus on a testimonial from a woman that came to last year's Health Expo, and she got a screening. And in that screening, she learned she was diabetic. Now, we get a lot of stories like this, and people often aren't real comfortable in sharing their story. But we contacted her because she then went to the Black Family Reunion where we had a table, and she came up to one of our volunteers and said, I learned I was diabetic at this year's Health Expo. And so we're able to tell that story now because she came forth and said, hey, I got screened, I learned I was diabetic, but now I'm addressing it. And so prevention is, again, the key. So we invite everyone out to the Expo, being a part of many of our activities and interventions that are really working to change the lives of our entire community.
And the date again for the Expo?
April 26th. Saturday, April 26th at Washington Park at 10 a.m. See you there.
Right. Make sure you're there. We thank you so much for being our guest here on InFocus today, informing us and focusing on minority health care, which is so important. For more information, visit www.closingthehealthgap.org and make sure that you have yourself in the place on April 26th. Alrighty, that's going to do it for InFocus. See you next month. Bye. Thank you.